Hello, everyone. My name is Kenyatta McMullen, and today I want to talk about patient privacy. I'm going to take you guys on a journey through what patient privacy is, why it's important, laws created to protect patient privacy, ethical decisions that impact it, how it's stored, and the training involved to help sustain patient interaction with any healthcare professional. In a clinical setting, managerial training, organizational ethics, and doctor patient relationships are key factors that affect patient confidentiality. So, what is patient privacy? Patient privacy is just like your credit card information, social security, birth certificate, or passport. You know, those highly sensitive documents that we all want to protect on a daily basis? Well, patient privacy is your right to decide when, how, and to what extent others may access your protected health information. Protecting patient privacy fosters understanding, which enables consumers to respect and carry on with care. When a trustworthy environment is created and patient privacy is maintained, the patient is more likely to seek treatment and to be as open and honest as possible during a medical appointment. Securing patient privacy is essential because numerous duties that come with the interaction, between patient and any healthcare professional is very important. So, why is patient privacy so important? In order to fulfill the needs of the patient and sustain a true relationship, patient privacy is very essential. Patient confidentiality is necessary for building trust between patients and medical professionals. Patients are more likely to disclose health information if they trust their healthcare practitioner. Trust based physician patient relationships can lead to a better interactions and higher quality health visits. If people feel their privacy is safeguarded, they are more willing to engage in and will not withhold any information, which essentially will give the patient a better outcome of healthy choices. When people forego medical care or engage in other privacy protective actions like withholding information, the healthcare system receives inaccurate and incomplete data. This data will have the same weaknesses since they are subsequently used for research, public health reporting, and outcome analysis. There are major laws that contribute to patient privacy. A federal law known as the Health Insurance Portability and Accountability Act of 1996, HIPAA, mandated the development of national standards to prevent the disclosure of sensitive patient information without the patient's knowledge or consent. Ensuring privacy can facilitate better patient doctor contact, which is crucial for the standard of treatment, increased autonomy, and avoiding harm to the economy, embarrassment, and discrimination. The privacy rule also establishes guidelines for people's rights to know their health information is used and to exercise that control. A key objective for the privacy rule is to guarantee that people's health information is appropriately safeguarded while permitting the flow of health information required to deliver and promote high quality health care, as well as to safeguard the health and well being of the general public, recommended by the CDC. The security rule, a series of guidelines to safely manage the confidentiality and integrity of accessibility of electronic PHI as it is created, distributed, managed, and received. The enforcement rule, provisions for holding covered entities and associates accountable through financial penalties and court procedures. The breach notification rule requirements for when and how covered entities and businesses associates notify related parties about the breach of PHI. The Personal Data Protection Act, PDPA, was created to protect individuals' rights, regulate the gathering, processing, and use of personal data, and encourage the responsible use of such data. Clinical nurses are the primary providers of patient care and are most likely to have access to patient data. These nurses risk breaking the law and interfering with patients' rights if they don't fully comprehend the PDPA. All these laws play a critical role in protecting patient privacy. So how is patient information stored? When you come into a physical doctor's office, the healthcare staff is not only thinking about your health, but of those various laws to protect our privacy. While in a physical doctor's office, healthcare staff uses the computer on wheels, which is called a CAL. Even though many consumers have moved from the physical visit, the computer on wheels is the longest running medical information receiver. This equipment is convenient, but does not have the security a patient needs in order to feel secure. For example, in an OBGYN office, a patient went in for stomach pains. As the patient was reviewing the information with their doctor was inputting patient's notes. The doctor revealed that the patient may be experiencing a miscarriage. Soon after, another healthcare employee came into the patient's room and logged into the computer. As the second doctor was looking up information, the doctor started reviewing information that and read the disclosed information about what the patient was reviewing with the previous doctor. The second doctor realized they went into the wrong room with the wrong patient. As the patient was distraught about the information shared from the second doctor, this created an ethical dilemma. On site doctor visits can have a negative patient experience through ineffective forms of communication and privacy concerns. Telehealth has various forms that allows the patient to have control over the information shared and communicate directly with their doctors. This will take me to the world of telehealth and how technology has played a key role in the advancement to store data and the breaches that come with it, creating ethical dilemmas. So, on those cows that they use in a physical doctor's office is known as a system called a health information system that enables healthcare organizations to collect, store, manage, analyze, and optimize patient treatment histories and other key data. These systems also enable healthcare providers to easily get information about macro environments such as community health trends. These systems are used to diagnose and treat individual patients effectively. Individual care providers and care teams must have access to at least three major types of clinical information: the patient's health record, the rapidly changing medical evidence base, and the provider's orders guiding the process of patient care. When selecting the interface of choice, patient engagement and secure document filing were the major choices for our assessment. So there are various systems for patient privacy, such as Cario, Athena, and Telechart. Athena Health incorporates interaction technologies like telemedicine services, patient portals, and online scheduling, which will create a strategy to sustain good health choices. Telehealth has created an ease for patients to have access to their own health charts and patient portals. A patient portal for patients provides quick around the clock access to their personal health information from any location with an internet access. A great product from the patient portal is online learning for patients. Online learning gives healthcare workers such as nurses, doctors, midwives, or any healthcare professional the ability to instruct and lead classes that help patients sustain healthy lives. You can access all of your personal health information from all of your providers in one place. If you have a team of providers or see specialists regularly, they can all post results and reminders in the portal. Providers can see what other treatments and advice you are getting. Telehealth has created a virtual world of screenings from over the phone to FaceTime videos, producing an ease for patients not going into an actual facility, increasing the risk of potential harm for themselves and for others. Teladoc is one of the mainstream virtual care screenings. With technology evolving, each healthcare system has created their own version of the virtual care. Virtual health exams cover emotional and psychological well being, health risk factors, as well as blood tests and biometric screening findings that the doctor would have reviewed before the actual session. The potential risk of virtual screenings is the unphysical attributes. The potential risk posed as incorrect diagnosis and prescriptions, creating once again an ethical dilemma. Virtual care became prevalent during COVID-19 pandemic, reducing the strain on the healthcare system. Virtual care allows providers to improve their team's efficiency and meet the needs of more patients while reducing the wait times, creating a better experience. You would think that with all the various tools such as patient portals, virtual screenings, computers on wheels, and the laws that protect patient privacy, like HIPAA and the privacy rule, that the patient would have control over what and when information is shared. But as we reviewed in the earlier content, that dishonestly accessing files can cause ethical dilemmas and others, such as losing devices, getting hacked, improper filing and disposing of documents, releasing patient information after the authorization period has expired. With those HIPAA violations, at least 526 out of the 713 breaches reported in the 2021 were categorized as hacking and IT incidents. These incidents accounted for 94% out of the total records breached, a staggering 43.1 million records in 2021. I want to review a case that caused severe damage to a patient and healthcare system, violating at least 2 HIPAA violations. Then we will review how ethics played a huge role in this case. According to Hometown Life, a 21-year-old woman is suing a Metro Detroit hospital and medical facility and a Canton woman on grounds that they failed to protect her rights and medical privacy. After being traumatically raped, the individual went to the hospital to conduct a rape kit, concluding that her attacker transmitted an STD. The healthcare provider proceeded to use social media, including Snapchat, to share the plaintiff's medical records with her friends and relatives. In this case, the healthcare provider not only caused severe damage to the reputation of the hospital, but created a breach of HIPAA violation that resulted in a fine and complete change of the hospital that once was Beaumont Hospital. HIPAA violations not only impact the accused, but may destroy the healthcare system in total and severe damage to the innocent. This case violated 2 violations: employees dishonestly accessing files, improper filing and disposing of documents, and most importantly, releasing patient information without authorization from the patient, which impacts autonomy and competency, the ethics of healthcare. HIPAA violations are serious and unethical. This brings me to the 4 ethics of healthcare and how ethics play a huge role in patient privacy. Ethics and patient privacy go hand in hand, going back to the sole definition of patient privacy and how it impacts patients' well-being, trust, and ultimately the relationship shared between the healthcare professional and patient impacts interactions and creates a higher quality health visit. Each ethical principle coincides with patient privacy and trust that is shared. Autonomy, the capacity to be one's own person and make one's own decisions without being manipulated by external forces. Competency, a person must be competent to make his or her own decision. The ability to act on the decision. This is very important to patient privacy because the patient information is so delicate and the patient wants to assume great intent from each interaction and has the capability to act on their own decision based on the information given and what can sustain a healthy life for them. Beneficence. A practitioner should act in the best interest of the patient. Patient privacy creates the trust needed to inform the patient that the acts performed by a healthcare practitioner is going to help the patient stay healthy or recover from illnesses. Non-maleficence, the duty to do no harm. Non-maleficence was a violation on our last case. The healthcare provider used Snapchat to do intentional harm to the patient by exposing their health information on Snapchat, causing an ethical dilemma. Justice, providing to an individual what his or her is due. The patients have the right to expect their private information, medical information, will be kept confidential. In this interaction, a physician was ultimately responsible for the confidentiality breach, an ethically and legally inappropriate action. The key ethical principles involved in this case are autonomy, competency, non-maleficence, and justice. Justice calls for all patients to be treated fairly and to be able to expect that their private medical information will be held in confidence. A breach of the patient confidentiality goes against a physician's pledge in the Hippocratic Oath that what I may see or hear in the course of treatment or even outside of treatment in regard to the life of patients, which on no account must be spread abroad, I will keep to myself, holding such things as reprehensible to speak about in order to be treated. Patients tell physicians intimate things about their bodies and their lives. To establish and sustain the trust that allows patients to impart these intimacies, physicians must take extreme care to protect that information from discovery of third parties. When confidentiality is violated, the patient is harmed, maleficence, as is the patient and physician relationship. Electronic health records give caregivers the tools they need to spot patient risk and behaviors, resulting in better preventative care. It allows doctors to focus on patients rather than numbers, which improves the quality of care and treatment. In the recent years, information technology has seen rapid changes and advancements across the industries, including the health industry. The move to retain patient health records in a digital environment is arguably the most significant of these advancements and changes in the health sector. This system, also known as electronic health records, is classified as an information system that performs a number of tasks, such as storing and providing access to patient personal health information, such as demographic information, results of physical examinations, notes on progress, issues, medications, vital signs, previous medical histories, vaccinations, laboratory results, and radiology reports in the digital setting. This takes me to my next point, which encourages technology to play an even more vital role in how healthcare systems will communicate more effectively. In order to have the best communication between healthcare systems, California will require health facilities to start sharing patient data with each other. According to Huang in Cal Matters, she discussed how hospitals, public health organizations, and other service providers lack a formal mechanism for exchanging patient data, which hinders their capacity to identify patterns and work effectively. A doctor or a caseworker would have rapid access to a patient's complete medical history under the state's new data sharing rule, and individuals would have simple access to their own records. To help sustain healthy choices when moving to a different healthcare system, it could be an advantage for patients to give access for interchangeable data. Accessing patient data from hospital to hospital should solely be left up to the patient. In the article, it was discussed if the implementation goes as planned, a doctor or caseworker could request a patient's full medical and social services history in real time. Patients would be able to quickly assess their own records, and government organizations will have access to more accurate demographic and patient outcome aggregate data, making the pandemic scramble obsolete. This stands to improve patient experience and quality of care would be a great way to help increase effective communication. I would only recommend that it should be only left up to the discretion of the patient to provide access to their personal privacy data. So, how do we help to improve patient privacy? Training is one of the greatest tools to be used for creating a culture of trust based interactions between patients and healthcare professionals. To create the training mechanism that each healthcare professional may need, it's recommended that each professional go through extensive patient privacy training. Employees receive training on the specifics of HIPAA Act. They are better at grasping their part in the compliance as a result. As HIPAA is an ever-changing process and an ever-changing law, companies can lose HIPAA compliance over time. And in that case, they need to provide more training to return to compliance. whether that is a monthly training for their healthcare professionals or something even on a weekly basis. Healthcare professionals are obligated to provide the best care possible and to protect the safety, privacy, and welfare for every patient that they come in contact with. Management must embrace compliance and have a thorough training on the patient privacy to overcome reluctance at all levels of the organization. In closing, I would like to leave you guys with a Bible verse that I feel comes very close to patient privacy, which states from the First Thessalonians chapter 4 verse 11, and it states, "And to aspire to live quietly, and to mind your own affairs, and to work with your hands, as God instructed you." This verse is very important to patient privacy because it creates the standard of living while minding thy own matters and concerns, and to make it your ambition to lead a quiet life. You should mind your own business and work with your hands, just as God told us. With God leading us to create lives by His will, it is important to understand the intention of living a tranquil life. As we quiet the outside noise, we're able to hear ourselves and the intuitive voice within. We might become clearer on what direction we want to make and what direction we want to take our lives. We might learn where we need to set firmer boundaries on our time and energy. We might simply become aware of what we like and what we don't. And I just want to thank you guys so much for listening. I hope you all learned something about patient privacy. And that is it. Thank you. Bye.